So what I want to talk about today is communication, specifically effective professional communication in a healthcare setting. A lot of what I'm going to talk about today is common sense or things that you already know. I'm just going to dial them in a little bit tighter and also talk about some of the mistakes that I see made in communication and also some of the mistakes that I make personally in communication as well. So the basics of communication, you know, there has to be a sender, a message, and a receiver. So your sender is who initiates the communication. The message is what needs to be communicated, and the receiver is the person who needs to receive that communication. So the first mistake that I see made in communication is selecting the improper receiver of the communication. You need to decide who it is that you need to talk to and talk directly to that person instead of going through intermediaries. Most kids have played a game. When I was a kid, it was called grapevine, where you whisper something into somebody's ear and they whisper it in the next person's ear and they whisper it into the next person's ear, and so on and so forth until you come around a big circle and the message that you receive does not reflect the message that you send out. So to cut out any possible miscommunication between other parties, you want to select the proper receiver for your communication. So some complications of communication are that the words that you say might be the right words, but they may be intercepted or received improperly. And that improper reception could be because of the tone of your voice, inflection. If you say something but you have an upwards inflection on the thing that you say, it could sound like a question rather than a statement. So the tone, if you use an angry sounding tone, you can say two sentences, identical sentences, and just the tone of your voice may communicate something totally different. You can use a sarcastic tone, and it completely changes the tone of the communication. Sometimes that's on purpose, sometimes that's subconscious. Body language, how is a person standing? What does their face look like whenever they're communicating to you? Are they scowling? Is that scowl their normal posture? Do they always look like they're mad? So the intent, the intended message and the communicated message may not necessarily be the same thing based on those things. So the projection, the tone of the voice, the inflection, and then certainly the interpretation is an issue as well. So sometimes you can say something and somebody, especially now in a world where it seems like people are offended over almost everything, then the interpretation could be totally not what you intended the communication to mean. So what we're going to talk about is electronic communication. We're going to talk about face-to-face. We're going to talk about phone calls, and there's going to be a common element between each one of those. So in each one of those, there's proper introduction. Introduce yourself. Don't assume that somebody knows who you are. A lot of people use an email address that has their name in it, but maybe the name is not the name that you go by. So in your introduction, you would start with, hello, my name is whatever your name is. And that way you don't have any kind of miscommunication or misunderstanding of who you are. Also, sometimes somebody will use somebody else's email address. And so the receiver of the message may think that they're speaking to somebody totally different. Properly address the recipient. So that's not address as in, make sure you have the right email address. Certainly that's important. But don't assume that you're on a first name basis with whoever it is that you're emailing. So address them, but address them, always err on the side of caution. So in my program, we are on first name basis with our students, and the reason for that is laziness on our part, pretty much. First off, the program, the history of using first names for instructors was inherited from previous instructors, previous program chairs. It's always been that way in my program. So it's not something that we've chosen. It's something that has a history to it. But also, my students are adults, and I feel like if somebody has to address me with a very formal, in a formal way, then I need to address them in a formal way as well. And I don't want to keep up with Mr. or Mrs. or whatever pronouns somebody might have. I'd rather address them by their first name, and if I have the expectation of addressing them by their first name, they should have the same expectation on me. So, but if you are not specifically told that, then you need to err on the side of caution and go with something more formal. Keep your conversation as brief as possible, so brevity is very important. Assume that the person who you're trying to communicate with has other things to do and don't take up too much of their time. What that may mean is that before you contact the person, you have a list of questions or topics that you need to talk about, and be as concise with each one of those things as possible. Spell check and grammar check. It comes on everybody's phone and it comes on everybody's computer, so there's never a reason to send an email out to somebody with bad spelling and poor grammar. Make sure that you check that before you send it. If you're sending a professional communication indicating that you have some sort of interest in somebody's program and is full of spelling errors and grammatical mistakes, then it just doesn't look good for you. So avoid abbreviations. You're not talking to your friend with a text message. You're talking to a professional in an email. So make sure that you don't use abbreviations. Use the actual words. Use the right words. Use good grammar. If you have questions to ask your questions. Maybe list them out. Don't put them in a single long sentence. Maybe go 1, this is my question. Type in number 1, this is my question. 2, question. 3, question. And it makes it a little bit easier to identify exactly what it is that you're asking. And then if you receive a response, make sure that you in turn answer all the questions that were asked back to you. A little bit more on that here in a bit. So ask your questions sequentially. Make sure you map them out, you list them out 1, 2, 3, and then if you get a response on each one of those, read the response, and if you get follow-up questions, make sure that you answer each one of those. So phone etiquette kind of follows the same pattern. Make sure that you introduce yourself. Not all phones have caller ID. Believe it or not, landline phones may come up with a number without any kind of caller ID on it. So make sure that you introduce yourself and make it as professional as possible. Somebody picks up the phone, this is so-and-so, you identify yourself. You say, okay, this is whatever your name is, and project your voice. Don't mumble, but project your voice. Sound like you have confidence and sound like you know what it is that you're after and why you're making the phone call. If you call and you sound unsure of yourself, then it kind of gives the impression that you're not really committed to what it is, the communication that you're trying to make. So properly address the recipient. So if I answer the phone, I use my first name, you might respond with, is this whoever it is you're trying to communicate with, the whatever department it is that you're trying to get in touch with. And you might use their last name, Mr. So-and-so or Mrs. So-and-so or something like that. So properly address the recipient. If they respond back with, you can call me whatever, by the first name, then certainly that breaks the ice and you know how to address that person. If they don't give you the permission to use their first name, then assume that you need to use a more formal title. Keep your communication as brief as possible. Know what you're going to ask it. And if you have follow-up questions, whenever they answer your question, first off, listen for the response and then formulate a follow-up question if you have one. If you don't have a follow-up question, thank them for their time and get off the phone. So keep it as brief as possible. But in your communication, again, you want to be brief. You want to use proper grammar if at all possible. You don't want to interrupt. One of the things that is aggravating is whenever somebody asks a question and you're answering the important parts of the question, and they've got a question that they just can't sit on, and they don't listen to your answer before they're asking another question. So don't interrupt. Let them get their answer out. If you call somebody and they're not in their office and you have to leave a voicemail, then speak clearly in your voicemail. Project your confidence, speak clearly, and speak as if there is somebody on the other end of the line. A lot of times what I get are these long, drawn-out, rambling messages. Hi, this is so-and-so, and I was just wondering. Don't do that. Just leave your message. Hello, state your name. I'm calling for information about the whatever it is. If you could, please give me a call back at, and then leave your callback number. What a lot of people don't understand also is that there's no stored numbers in callback for phone calls missed. So if I get a phone call with an email and there is no name and no callback number, I don't know who called. I don't know who called. I don't know how to get it back in touch with that person. All I can do is delete the message. So you need to speak clearly. You need to not have these long, drawn-out messages. Identify yourself. Leave a summary of what it is, of why you called, and then leave a callback number. Make sure you leave the callback number, but don't sprint through the number. That's another mistake I see made in a lot of cases. Is somebody will call and they'll leave these long messages, and then they'll cram their phone number into about a half a second. And I can't pick that up. The numbers just run together and I can't discern them. So leave the number 911-678-1234. And I know I just said 911, and that's going to go to emergency services right away. That's not an area code, but you get the point. Say it and then say it again. Leave your callback number and then repeat the callback number to make sure that they got it properly. You could even leave your short message and then say, again, state your name, and then leave your number a second time so that there's no mistakes. So you leave your message and you're expecting a call back. Some of the mistakes I see here are, one, if I make a call back, I'm going to call back one time, and if your voicemail box is not set up and it can't receive messages, you missed my call and your voicemail box can't receive messages, I've got nowhere else to go. If I can leave a message, I'll leave you a message back and I'll tell you why I called. If in your message you told me exactly why you called, I'm going to give you the information that you asked for in your message. So this is jumping down just a little bit, but make sure that before you return the return call that you listen to your message if at all possible. So make sure that you have your mailbox set up. Make sure it's not full. If at all possible, answer the phone whenever the person calls you back. But sometimes I understand you can't answer the phone. If you're at work, you can't answer the phone. So sometimes it'll go to voicemail. You have to send it to voicemail. Just make sure your voicemail is set up and the box isn't full. So if you miss the call, check your voicemail before returning the call again. You don't want to make somebody explain the same things twice. When the person identifies themselves, that's your invitation to speak. And what I mean by that is, let's say you called, left a message. The person called you back and left a message. You call them back and they answer the phone, and they identify themselves. It's your job at that point to pick up the communication and say, yes, I called you about this, and this is what I need to know. This is what I'd like to find out. So that's your invitation to speak. One of the awkward communications, voice telephone conversations, is whenever I call somebody calls me, I call them back, leave a message, they call me back, I answer the phone, and the person say, yeah, I just missed a phone call from this number. That's the same number you just called. So try not to have any dead air. Understand who it is calling you back if at all possible. So in your face-to-face conversations, what you want to have is good eye contact if at all possible. You want to walk in and have good eye contact. If you're Post-COVID, handshaking is a little less common than what it used to be. But if you do happen to have a situation where handshaking is appropriate, then make sure that your handshake, if you shake hands, that you give a firm grip on the hand. Try not to have a limp hand. It projects confidence whenever somebody shakes hands firmly. Now, I'm not talking about trying to have a competition and try to squeeze somebody's hand and hurt them, but make sure that you wrap your fingers around their hand and shake their hand, actually shake their hand. So good eye contact, good introduction. Again, you want to walk in, you want to say, my name is whatever, and do you have a minute, maybe? If you're approaching their office, if they're sitting in their office, what you don't want to do is walk straight in and stop right in front of their desk. You might stop at the door and knock on the door and ask, do you have a minute? And if they say yes, come on in, then certainly come on in. Make good eye contact, introduce yourself, and tell them what you want. So properly address the person. Again, ask maybe, are you Mr. So-and-so or are you Mrs. So-and-so? Keep your face-to-face meetings brief, just like the email and the phone communication. Make it as brief as possible. Know what you're going to ask. Again, write it down if you need to. There's no harm in bringing a notebook or some sort of note and making sure that you ask all the questions that you want to ask. Most people would rather you ask the question on that initial meeting than having to call them back and say, I meant to ask something else and forgot to. So write it down, know what you're going to ask, and take care of it in a single meeting if at all possible. So use good grammar, keep it brief, don't interrupt, and don't anticipate the other person's response. So you ask a question, they start to answer your question, and again, you think you know what they're going to say, and in a lot of cases, you just don't. So listen for the answer before you respond back again. I know sometimes it's hard because you might be excited about something. So communication with different populations, again, this has to do with healthcare settings, and we've got different populations of healthcare settings. I'm going to kind of divide those up into patients and professionals, medical professionals that aren't doctors, and then the medical staff, which would be the doctors. So in speaking to the different populations, you might use different vocabulary. So we're going to use layman terms in certain circumstances. We're going to use professional jargon. The word jargon gets kind of tossed out like it's a bad word, and professional jargon just means that it's language specific to a profession. So it's not a bad word. It's just words that maybe not everybody knows, and therefore you don't want to use professional jargon, a lot of professional jargon, in front of patients or people who might not understand those words. So then we've got patients and family members. We've got kids. Even in the patients, we've got different populations. We've got kids, adults, and then we've got elderly patients as well. So communication with different populations. Again, we've got communication with technologists and students. So those would be your professionals, your healthcare professionals. And you've got communication with other healthcare professionals. So you've got nursing staff, you've got respiratory care, you've got medical laboratory. So you've got a lot of different populations within healthcare too. And then communication with the doctors, and most of the time in the x-ray department, in the radiology department, that's going to be a radiologist. But if you happen to be working in surgery, then it's going to be surgeons and so forth. So this is a really busy slide, and there's a few of these in here, so just kind of bear with me on this. But whenever you communicate with patients, again, know your population. Is it a child? Is it an adult? Is it an older patient? Prepare yourself mentally. Try to find out something about the patient before you go in. And I don't mean something personally about the patient, but rather, what is their mental acuity? Can they communicate? Are they an older patient and they've lost their hearing? or you're going to have to show them more than talk to them. So prepare yourself mentally for what you're walking into. Project confidence. Whenever you get in front of a patient, one of the last things they want to see in you is whether or not you're unsure. That's kind of difficult whenever you're in training because you're unsure of a lot of things, especially early in your training. So learn to project confidence. Early in your training, you should have somebody with you anyway, so there's really no reason for you to be less than confident because you're going to have somebody who's got your back. And it might be a little bit embarrassing to you if you don't really know what you're doing, but most of the time the technologist that you're working with or the professional that you're working with can kind of cover for you a little bit and make it a little less embarrassing, a little bit less obvious. So project confidence. You're not going to hurt the patient as long as you have somebody with you who knows what they're doing. Most likely you're not going to hurt the patient. So be confident. Introduce yourself. Explain what it is that you'll be doing to the patient, if at all possible. Again, make sure that you're not using communication that's overloaded with professional jargon. For example, when we do a chest x-ray on a patient, most of the time we're going to do two views of the chest x-ray. One is what I'll refer to as a frontal view of the chest x-ray, and that's going to show the chest x-ray from the front to the back. All right, so it's going to show the entire lung. The x-ray is going to be as if the patient and a skeleton of the patient is looking directly at you. That's what a frontal view would be. And then we're going to shoot one from a side view. So the frontal view, most of the time, what we're going to call that is a posterior anterior projection chest x-ray. So your patient doesn't want to hear that. About the only thing that your patient's going to want to hear is we're going to take two views of your chest x-ray, or we're going to take two views of your chest. We're going to take two images of your chest, and that's it. So use appropriate language. Don't weigh the patient down with overly verbose professional jargon. Don't over-explain things to the patient. So explain what you're going to be doing. Be concise in that explanation, but also use proper terminology and verbiage to explain that. So use your appropriate language. Use economy and motion. So some of the exams that we do, especially the contrast exams, we're going to have the patient roll into a lot of different positions. And with that rolling of positions, let's say we're doing a barium enema on a patient, and if you're not familiar with what a barium enema is, it's exactly what it sounds like. We're going to take some barium sulfate, and we're going to put it inside of the patient through an enema, and we're going to roll the patient around in different positions. So economy of motion would imply that what you're going to do is you're going to try to move the patient as little as possible because you've filled them up with fluid and you don't want to have an accident. But it can be more simple than that. One exam type that we do, we call an acute abdominal series, and it sounds a little bit misleading, but what that is a one view chest and a two view abdomen. So what we're going to do is we're going to do that posterior anterior chest x-ray, that frontal view of the chest x-ray. That's one view, and then we're going to do one view of the abdomen with the patient standing up and one view of the patient with the patient laying down. So what you would want to do is not get the patient out of a wheelchair, stand them up for a chest x-ray, put them on the table for a laying down abdomen, and then stand them back up for an upright abdomen. So you're taking them across the room multiple times. Economy of motion would be that you would do the upright chest x-ray followed by the upright abdomen, then put them on the table, and then put them back on the wheelchair. So move the patient as little as possible. It makes you look more like you know what you're doing. So consider, again, we're back to mentally prepare. Consider your exam type and what it is that you're doing, and use as few motions as possible to get the job done. And it makes you look more competent, like you know what you're doing, even if you don't yet. And I certainly know when to ask for help. Everybody needs help at some point. Maybe it's because the patient is particularly difficult, and maybe it's because you're very early in your training and you don't quite know what it is that you're doing. So instead of pressing forward and doing something that you know is most likely going to turn out bad, and I don't mean with a bad outcome that hurts the patient, but an x-ray that you don't need to expose the patient to the x-ray beam because you don't know what you're doing. So you would ask for help instead of going ahead and exposing the patient. And then explain to the patient what they need to do following the exam. So don't take anything for granted. Don't take anything for granted. Make sure that you give the patient concise instructions. And I use this in my chest x-ray lecture. One of the things that we need to see whenever we're doing a chest x-ray on a patient is we need to see the lungs as full of air as possible. And what I learned early on in my training, this was a long time ago, but what I learned early on in my training is that if you forget to tell the patient to breathe, in some cases the patient will continue to try to hold their breath. And what I mean by that is whenever we're taking a chest x-ray on the patient, we want the patient taking a big deep breath because we want the lungs inflated as much as possible, but we want them to hold their breath so we don't have any kind of motion on the image. So after you make your x-ray exposure, you tell the patient to breathe. I've had patients who minutes afterwards would blow all their breath out, take another big deep breath in, and hold their breath. And this was after they were back in the wheelchair and ready to go back over to the ER. Don't take anything for granted. Make sure that you explain to the patient, when you're done, and not only when you're done, but if there are any kind of follow-up instructions that they need to follow. Okay, so communication with technologists. I kind of touched a little bit on this, I think, in the last video. Making sure that you keep your position in the hospital straight and what it is that you're trying to accomplish in your training program. So you're trying to learn to be a technologist. You're not there to make friends. You're not there to have a good time. Certainly, if you're having a good time at work, if you find it enjoyable, that's great. Everybody should find some enjoyment in their work. But your primary objective in clinicals is to learn how to do the job. So in that, you want to make sure that you keep your communication with the technologist professionals. Know what your position there is, that you are a student. The student is there to learn. So understand your technologist role in your education. Some technologists that you work with, or if you're in a nursing program, some of the nurses you might be working with, might give the impression that they don't really care to have you there. They're not enjoying teaching you. They wish you weren't there. And I can say almost universally, even if they won't admit it, nothing could be further from the truth, because what they're doing is they're training their future co-workers. Most of the students that we have, I say most, at least half of the students that we have will be offered a position in their clinical site by the time they graduate from the program. So they're training their own co-workers, and they want you to be competent. It just may be that they're bad at communication. It may be that they're bad at teaching. It may be that they feel inadequate at teaching, and therefore they compensate with what comes off as a little bit of aggression. But most of your technologists actually want the students to be there. Whether or not they admit it, they do want the students to be there. So if necessary, ask questions prior to seeing the patient. So again, if this goes back to the last slide, if you get a patient, or when you get a patient, try to find out something about the patient. Ask questions. What is it we're doing? This patient's in a wheelchair and we need to do pelvis on the patient. How are we going to accomplish that? This patient's on a stretcher, but we need a chest x-ray, and we want the chest x-rays. Most of the time we want to do a chest x-ray with the patient upright. How are we going to accomplish that? The patient's on a backboard. They're in a trauma and we need a chest x-ray. How are we going to accomplish that? So ask those questions before seeing the patient, if at all possible, but understand your technologist. Some of your technologists are going to be more open to questions than other technologists. You're going to learn that as you go through. But make good eye contact. Use eye contact body language with technologists for communication in front of the patient. Sometimes you may have to ask a question or point something out that the patient doesn't really need to hear. If you see, I don't know, bleeding from a place that you didn't identify before, you might nod and look at something specific rather than just blurt out, hey, the patient's bleeding from their side, and the patient didn't know it, and now the patient's in a panic. So sometimes you might need to just use some body language, looks, and things like that in order to communicate. And the technologist will do that as well. In a lot of cases, your technologist will communicate more with you in front of the patient with body language and eyes than what they will with words. So this next one is kind of tough to describe, questioning versus asking questions. So again, you're going to work with some technologists that are really, really fantastic, and they're going to explain everything to you, possibly in front of the patient, in a way that does not alarm the patient. Some of your technologists just don't communicate that well, and instead they might not even make that eye contact with you. So if you have a question or you see a technologist doing something that is not what you learned, your first position in that should not be panic. So I know that I talked about this in the recording where I discussed didactic classes versus clinical classes. What you'll see in your didactic classes, or what you'll learn in lab and your classroom classes, is what will be on your credentialing exam, the ART exam. What you're going to learn in clinicals in a lot of cases does not completely reflect what you learn in class. So if you see something in clinicals, let's say you're doing a chest x-ray on a patient, again, they're on a backboard, or let's say they're not on a backboard, but they're on a stretcher, and they raise the stretcher up to 45 degrees, and they make the x-ray image with the patient partially upright instead of fully upright, don't blurt out in front of the patient, why are you doing that? That makes the patient feel like the technologist doesn't know what they're doing. You know, the technologist is the most experienced person in the room. Now suddenly you're at odds with the technologist. That's questioning the technologist. Don't question the technologist in front of the patient. You can't ask questions though. So let's say that's the first time you saw what we refer to as stretcher chest, and you walk out of the room and you say, can I ask why it is that we did that procedure this particular way? And most of your technologists are going to be very responsive to that and probably respectful that you didn't blurt that out in front of the patient. So questioning the technologist in front of the patient, big no-no. And that's going to get you a reputation in clinicals, and a lot of your technologists not going to want to work with you. So know when to ask questions, how to ask questions. So things not to do, again, regardless of who's doing the procedure, don't question or correct the tech in front of the patient. So another thing that you want to avoid is, well, that's our positioning textbooks. The main two positioning textbooks in radiography are Merrill's Atlas of Radiographic Positioning and Bontrager's. And so let's say you're doing a chest x-ray on a patient, and the technologist is doing something a little bit different than what you learned in class, and you blurt out, that's not what Merrill says. Regardless of whether or not you're in front of the patient, that's probably not a good way to go about getting an answer to the question, why did you do things the way you did them? So remember that there's a lot of different ways to get to a specific end result. Your job in clinicals is to try to pick up on what would work best for you in those different circumstances. So don't argue with the patient or the technologist, especially with the technologist or the patient in front of the other. If the patient says that they don't want to do something, you can educate them and you can tell them why it's a good idea to do whatever it is that the doctor wants them to do, providing you know the history of the patient. If the patient is suspected of having a specific condition and it's documented and the patient knows that, then you can encourage the patient, but you're not going to argue with the patient. And certainly the technologist, if you're a student, the technologist is going to have more experience than you do. So arguing with a technologist, the right and wrong way to do things, is probably not a good idea. If you make a mistake in clinicals, don't take your correction personally. Take it as a learning experience and try to not make that mistake again. Me personally, I'm a hard learner. Generally speaking, if I'm going to make a mistake, I'm going to make it twice. I started this video probably 5 times before I started getting a, kind of a roll going. So if you make a mistake, that's fine. Learn from it. Try not to make it again. If you make it a second time, try to not make it a third time. I mentioned this in the last video on clinical education that in our career field, before we went digital, the average technologist repeat rate for exams was about 8%. So almost 1 in 10 x-rays had to be repeated. So even on a professional basis, you're going to make mistakes in clinicals. So if you're making the same mistakes over and over again, that's a problem. But the correlation here is that if somebody tells you you're making a mistake, don't immediately take offense to it. Try to learn from the situation and move forward and not make the same mistakes over and over again. So more things to consider. Again, a busy slide. Apologize for that. Learn from those mistakes, good and bad, or learn from the experiences, good and bad. Learn from the technologists and the supervisors, be they good and bad. I've had some of the best supervisors on the planet. I've had some of the worst supervisors on the planet. Each one I was able to pull something out of and either learn a lesson on what not to do or what to do as a supervisor, as an instructor, as a technologist. So any experience that you have, be it good or bad, you can learn something from it. Most of the time, I know I put in here nobody likes confrontation. That's not entirely true. Some people love confrontation, but most people do not. So if you ask a question in a way that comes off as a little bit aggressive, then the tech's default position may be defensive. So I can be kind of blunt, and so sometimes I'll say something that I don't necessarily mean to be aggressive, but it comes off that way. And I understand that's a problem I have. My job at that point is not to escalate things. So same thing with some of your technologists. If you have a question and you word it poorly, then the tech's default position may be to be defensive and either completely shut down or to, it's basically a fight on. So consider your tone and your words. Instead of saying, why did you do that? You might preface that with, can I ask you why you did that a certain way? You could also word things in a way that sounds almost like a compliment. How did you do that? Right? Instead of, why did you do that? How did you do that? It sounds more like you're trying to learn how to be more like them. Flattery is a good way to offset a little bit of aggression, or to not make things sound so aggressive. Or how did you catch that? Catch that being, how did you notice something and make adjustment for that? Maybe a variation on how to do specific things. How did you catch what was going on with the patient and know how to adjust to that type thing? So just some different ways to consider asking the same questions that don't sound quite as aggressive. So more things to consider. Understand technologists and individuals. Some are exceptional, and I don't mean exceptional it could be exceptional in the way that they do things, but also exceptional in how it is that they interact with the students. And some are exceptional technologists. They just don't articulate well. They can't explain what it is that they did or why they did what they did. Me personally, I have a difficult time sometimes delegating. So by the time I try to explain to somebody what it is that I want, I could have already done it. So I have a tendency just to do things. So I just sometimes can't articulate well enough to get things done expeditiously. I can just do them myself. So some just don't articulate well, can't explain why they're doing what they're doing. So if you continue after them and say, why'd you do that? Why'd you do that? Why'd you do that? It becomes annoying. So sometimes they might or respond with aggressive tones. Again, and sometimes that has nothing to do with you and more to do with insecurities in themselves. If you're asking in proper ways and they still come off as aggressive, just understand it's probably not you. It's just that, that's them and their insecurities in some cases. And some just had a hard day. Everybody's had a hard day. You come home and snap at somebody at home because you had a hard day at work or hard day at clinicals. Well, the same thing happens at clinicals. If somebody has 2 or 3 or 4 bad patients in a row, have bad interaction with the radiologist or surgeons or something like that, and next thing you walk up and ask a question they just weren't prepared for, they might snap at you. So just understand that, again, it's not you, it's just what has happened to them. Don't let it ruin your day that they've had a bad day themselves. And some just respond the way they were trained. So some of your technologists worked with somebody who was not a good technologist to work with, and that set kind of an example for them that they never outgrew. So try to understand that as well and not be that person. So if you interact with a technologist that's not a good teacher and not a patient person, and they tend to come off aggressively to any kind of questions, just learn from that. Again, you can learn from the good, you can learn from the bad, and in that case you would be learning not to be that person who just comes off as aggressive. So communication with other medical professionals, again, we've got a lot of different professionals in healthcare. The patient should always be the first concern. Sometimes there's going to be conflict, interdepartmental conflict. Patient may be scheduled for multiple things all at the same time. So what is it that the patient needs first? And that should always come first. Patient should always come first. Understand the role of the other professions. You don't have to know everything about the other profession, but understand the basics of it. For example, if you get to the room at the same time as med lab, and med lab says, well, I need to draw an ABG. ABG is arterial blood gas, and what they do is they take arterial blood, usually from the patient's radial artery in the wrist, and it's probably going to take them all of less than 5 minutes. So it's a deep stick. It's painful for the patient. It's a deep stick, and they got to draw some arterial blood, but it's just needle stick. So if we're doing a chest X-ray and we've got to take the patient down to the X-ray department, take the chest X-ray, and bring them back, the patient's going to be gone. Best case scenario, 15 minutes. You can wait 5 minutes, most likely, for the patient for the med lab to draw the arterial blood gas. So understand a little bit about the other professions, and again, keep the patient first. In 20 minutes, they could have both exams completed, right? Whereas if you take them to the X-ray department, then med lab may not be able to get back to them for another half an hour or so. So it's either 20 minutes or 45 minutes. So patient's best interest would be to have the ABG done before they go for the chest X-ray. So patients should always come first. And then don't overestimate what they might know. Likewise, your other medical professions are going to know a little bit about X-ray, but they might not know everything. So like decubitus. In radiology, decubitus implies 2 different things, and I'll get to that here in a second. But the word decubitus just means laying down. And you can describe the position of the patient. If they're laying on their chest, that's going to be, this is their ventral surface. Like when you breathe, you ventilate, right? And you see your lungs go in and out, or you see your chest going in and out. So the back doesn't really do that, the front does. So if you're laying on your chest, then you're in a ventral decubitus position. If you're laying on your side, it's a lateral decubitus position. Dorsal fin on a shark or a dolphin is that fin that sticks up out of the water. It's a fin on their back. So the back is your dorsal portion. If the patient's laying on their back, that's a dorsal decubitus position. But in radiology, what we're doing with a decubitus x-ray is we're not only laying the patient down, but we're also using the x-ray beam where it is horizontal. Horizontal means parallel to the horizon. So if the horizon is going this way, then the x-ray beam is going that way as well, right? So that's horizontal. And the purpose for that is, like I've got a glass of water here, so that we can see air fluid levels. So what we've got here, there's ice in here too, and I hope the camera picks this up, but the water level is right here. And if I'm looking directly down onto this glass of water, you can't see what the water level is, but if I'm looking with a horizontal x-ray beam, I can. So in x-ray, that's what we're doing, is we're trying to get a good look at air fluid levels. So if you walk into the patient's room and say, I'm going to do a lateral decubitus chest x-ray on a patient, your other medical professionals probably are not going to know what all that entails. So you may have to describe it a little bit and explain why it is that you possibly might need some help in achieving what it is that you need to do. So medical staff, now I'm talking about your doctors. With medical staff, you've seen a common theme here. Don't interrupt, be concise, repeat the orders back, don't get rattled, project confidence. So some of your doctors are going to be pretty short, and they're really pressed for time, so they need you to be concise. So if you start rambling, they might interrupt you, but don't let that rattle you. Just understand that you're kind of being verbose. Reevaluate what it is that you need the doctor to understand, and try to communicate very concisely. If he's giving you instructions, he or she is giving you instructions, you might need to take notes. So some of the exams that we do, the doctor may want specific views on the patient. So if you think that you might forget, if you get all nervous, then you might want to take notes, put them on your hand, take a pen and paper, and write those things down if you need to, but be as concise as possible. So feedback, as a student, you're going to get a lot of feedback, and that feedback can be positive or it can be negative. If you get positive feedback, express appreciation, then let it go. Don't follow somebody around and seem to be the lapdog because they gave you positive feedback. Just say thank you, I really appreciate it, and then just let it go. Negative feedback is a little bit more difficult, and we're going to talk about that. So negative feedback in a lot of cases leads to conflict. Okay, so with negative feedback, what you're getting is again, correction. We talked about correction before. Try to understand what it is that they're trying to tell you, and understand what it is that you did wrong, and try not to make those mistakes again. If you make those mistakes over and over again, then in a lot of cases it's going to lead to a higher level of correction and possibly some conflict. So in your conflict resolution, what you need to understand is, where is your part in that conflict? Are you a part of that conflict? If you are part of that conflict, where do you lie in that? So learn the facts, figure out what it is that you need to know about that specific conflict. Try your best to stay calm. Again, in a digital world, it has become a little bit more difficult to remain calm in the face of conflict, because it's become so common and easy to get aggressive in digital communication, on social media and things like that. So try your best to stay calm. Think about what you want to say before you say it. Don't make it personal. Again, this is not social media, so don't make it personal. Don't respond with emotion, and I know that becomes very difficult sometimes, and look for common ground. So if there is a possibility for common ground, say, I understand what you're saying, and this is what I'm trying to communicate to you. in most conflict, it's kind of like getting two sides of different stories from different people. You know, the old saying that there's always three sides to every story. There's your side, my side, and the truth. Understand that that's probably, regardless of what the conflict is, that's probably what's going on in the conflict, is that somebody may be more right than the other, but there's almost, I won't say almost, in a lot of cases there's not a situation where somebody is absolutely right and somebody is absolutely wrong. In a lot of cases there's some common ground there. So look for that common ground. Look for verbal cues in that conflict. So what's the patient, or it could be the patient, what's the other person's body language implying to you? Are they closed off, their arms crossed, are they scowling at you, are they turning their back on you, things like that? And if that's the case, for the most part, conversation's over, and there's no reason to follow them around and badger the point. But if you're still communicating in some respectful way, then focus on the facts and stay on track. Again, try not to make it personal. Try not to take anything that they're saying personal. Look for your common ground. Determine where you can compromise. Determine where you cannot. And if it's a patient issue, the patient is that determining point. What's best for the patient is, what is the absolute, let's say. So recognize your part in the conflict and know when to shut down the conversation. Again, look for those verbal cues. Listen to what they're having to say. If there's just no middle ground, no compromise whatsoever, it may just be time to walk away from the conversation, pick it up later on. It may be time to walk away from the conversation, not pick it up later on. Some conversations need not be restarted. So how to avoid escalation? Again, don't treat it like a social media debate. When possible, think before you speak. So some people will speak faster than what you can respond. And if that's the case, again, it may be time to shut the conversation down. If it's going to be one-sided and it's just going to be a lecture, probably not a good situation to be in. You just no winning in a situation like that. Don't always assume that the other person's position implies the worst in you. Most of the time, people in a situation where you've got some sort of conflict going on, some of the words are going to come out wrong. Some of the words are going to come out sounding more aggressively than what they intend for them to be. So don't assume that what they're saying is the worst possible situation, or that they're naturally trying to insult you. So you avoid those knee-jerk reactions. Clarify when you need to, and say, okay, this is what I meant. If you say something that elicits a response that seems to be more aggressive than what you think it warranted, you can say, wait a minute. Let me explain myself. Let me clarify something. Okay, so try to do your part to de-escalate the situation if it seems like it's spiraling out of control. And finally, if it does spiral out of control, know when to stop. If you've asked a question or asked somebody for something and they've ceased communication, let the answer be the answer. If they've given you an answer, sometimes it's just best to just let the answer be the answer. And again, sometimes a situation can become so hostile that continuing the confrontation, even to the point of clarification, is not going to do anything but make matters worse. So sometimes there is no resolution. Sometimes there is. So sometimes there's a time to say, can we talk about this later? And sometimes there's just the best thing to do is turn around and walk away. So what to do if things escalate? Recognize that it's escalated, and try to take those steps to try to de-escalate. Verbalize it. maybe the other person doesn't really recognize that things are kind of going sideways, and say, okay, this is getting a little bit hot. I think we need to either cool down and discuss this later, or again clarify and say, what did you think I was trying to say? Try not to make that sound as aggressive as what I just did, but try to clarify the point and try to bring it back down. Possibly in the conversation, bring it back around after a cool down period on your own part, because chances are, it's like your mom always said, it takes two people to fight, right? It only really takes one person to pick a fight, but it takes two people to keep a fight up. So own your own part in it. Say, tell the other person, I shouldn't have said this. I apologize. Can we talk about this? Come to some sort of resolution on this. And just know when to leave it alone. There's just sometimes that it's best not to pick it back up. So to wrap up, be professional, be thoughtful, be respectful, be confident, be concise. In almost every aspect of life, less is more. Not always, but almost always, less is more. So the fewer words that you can use to communicate what it is that you need to communicate, most of the time, the better off you are. And then again, if you find yourself in that contentious situation, just try to take the steps, de-escalate it, and understand that there comes time to walk away and pick it back up later on. So if you found this at all helpful, then please like, share, subscribe. If you make any kind of comments, I'll be sure. So thank you very much for listening.